everybody to today's presentation on heart health. My name is Dr. Jeff Gelband, and thank you so much for joining us. Excuse me. February is Heart Health Month, so we're gonna talk a little bit today about that. Before we dig too deep into it, I'm gonna give you a little bit of an explanation about who I am, who Aligned Modern Health is, kind of what we do. So let's get going. Okay, so at Aligned Modern Health, we are an integrative medicine practice, and we're broken up into four basic parts. We have chiropractic physical medicine, where they deal with musculoskeletal injuries, musculoskeletal pain, athletic performance, a little bit more of what people think of when they think of a chiropractor or physical therapy. Our acupuncture and Chinese medicine group deals with stress, anxiety, emotional disorders, women's health, and more. We even have a partnership with them and a Chicago-based fertility clinic. They do some incredible work there. Our massage therapy team deals with stress and anxiety, fibromyalgia. They do not only relaxing massage, but also therapeutic massage. And then I'm part of our functional medicine team, functional medicine clinical nutrition team, excuse me, where we deal with gastrointestinal disorders, autoimmune disorders. The simple way I like to explain what we do is we treat the things your primary care doctor treats, but without the use of drugs and surgery. And so we take this whole practice and we try to take an integrative approach where we combine all these modalities to give you the best healthcare possible. All right. Tell you a little bit about myself. So I'm a board certified chiropractic internist. I am the associate director of the functional medicine team. Some of my specialties are nutrition, cardiovascular health, digestive health, and hormonal issues. I'm proud to serve as a master sergeant in the Illinois Air National Guard, and I'm actually a BLS CPR instructor down there where I train and certify military members on effective CPR. So that's a little bit about me. But why are we talking about heart health today? So from Johns Hopkins Medicine in the US, 2,200 deaths per day occur due to cardiovascular disease, averaging one every 40 seconds. So it's huge. And, you know, I'm saying that, I know most of you coming here already know that cardiovascular illness, cardiovascular disease is a huge issue. It's the number one killer of men and women in the United States. So it's a big deal. 78 million adults have high blood pressure. Another 20 million have diabetes. You may not know what the connection between diabetes and heart health is. We're going to discuss that a little bit later too. An additional 8 million adults have undiagnosed diabetes, and 87 million have pre-diabetes. And I wish I could tell you these numbers are getting better. This is a huge public health problem that we have in the United States, and there are a lot of different fronts trying to help this, and we're one of them. But it's a big problem. Cardiovascular disease is the cause of more deaths than cancer, chronic lower respiratory disease, and accidents combined. Again, just to give you a scope of how huge this really is. And again, or another piece, on average, someone suffers a stroke every 40 seconds of every day. So we're going to talk about how you can help yourself prevent some of these things from happening to you. So when we talk about cardiovascular disease, you know, what is cardiovascular disease? Well, it comes in many different forms and flavors, but I'm going to go through a few of the more common ones here. So you may have heard some of these terms before. Arrhythmia. Arrhythmia is an abnormal heart rhythm that can occur in different parts of the heart, but essentially it means that some part of the heart isn't pumping the way that it's supposed to, and that it has an abnormal rhythm. So that lub-dub isn't happening the way that it should. Atherosclerosis. This is the plaque buildup. This is that plaquing of the arteries that we hear about a lot. It's one of the more common contributors to heart attack and stroke. And so it's something that's a really big deal, and it builds up over time. This isn't something that happens all of a sudden. It takes years and years to progress. Heart attack. So I mentioned, you know, atherosclerosis is a cause of heart attack and stroke. In this case, a heart attack is blood flow stopping, being partially or completely blocked to some portion of the heart. Remember, the heart is a big muscle. So when some part of it can't get the oxygen it needs, that part will have a hard time beating. And if it completely loses its ability to get a blood supply, then it'll actually, that piece of the heart will die. That tissue will actually die and become damaged. And sometimes that's irreparable. So that kind of gives you an idea there. That's another, all of these are a very big deal. Heart failure. Heart failure is the heart isn't pumping blood as well as it should be. This can happen again in multiple places in the heart. We sometimes call it congestive heart failure, but essentially if one part of the heart is not able to pump blood, the blood backs up. And so we get kind of a pooling going on there. Heart valve problems. So heart valve problems, that's actually, the heart valves are what cause the lub-dub noise. And it can be a few different things where either the heart valves don't open enough, meaning they don't let enough blood through, or sometimes they don't seal properly. And then blood can actually go backward a little bit. Both of those cause different kinds of issues. And then finally, stroke. So stroke, there are a couple different types of stroke. The one I have described here is obstructive stroke, where a blood vessel that feeds the brain gets blocked. There's another type of stroke I'm going to talk about a little bit later, just briefly, called hemorrhagic stroke, where a blood vessel ruptures, which doesn't allow the brain to get the blood that it needs. All right. So behind the scenes, kind of how does this stuff occur? You know, what contributes to these, and what do I do about it? So first and foremost, when cardiovascular disease occurs, the first thing that happens is endothelial damage. And what that really is it just means endothelial is the inner vessel wall. And it just tells us that that vessel wall is getting some damage. After it gets damaged, you can think of it kind of like a scratch. Just like we get a scratch, we like on the outside of our skin, and we get a scab, we get the same thing inside the vessel. So if there's a little scratch, we get a blood clot. The resulting blood clot is minimized, so over time it kind of sloughs off, and eventually a new layer of vessel, of that inner vessel wall, grows over the top of it, and then the blood clot has difficulty, or I'm sorry, then the blood clot incorporates in the vessel wall, and then everything's good there, it's gone away, we've healed the injury. This process is an inflammatory process, and that's not a bad thing. I know you may have heard in the news or somewhere that there's inflammation, and inflammation is this big bad boogeyman. It's really not. Inflammation is a healthy process that we need. We need it to survive, in fact. But where we get a problem is some people have too much inflammation, and that can indicate too much damage. The problem, one of the bigger problems with cardiovascular disease, is that when the body's rate of damage exceeds its ability to repair itself, and that is where we can get that increased plaquing. We're going to talk about that in a second. And that also goes where you get diabetes from, where your body can't compensate for this elevated level of blood sugar anymore. And so now blood sugar goes too high. So we'll talk more about that. Okay, so this is how we evaluate your risk, and I'm going to take a second and dig a little deeper into cholesterol. We'll go there in a second, but we use a number of different tools to evaluate risk. If you've gone to your primary care doctor, they may have run a lipid panel on you, which looks at triglycerides, it looks at cholesterol, and a lot of other markers. With that is one very, very important way of evaluating risk. But when we're evaluating risk, we try to take more of a whole body approach. So in addition to cholesterol, we also look at insulin, blood sugar levels, HSCRP, C-reactive protein, and I'm going to talk a little bit about these, but I want to talk about cholesterol for a moment because I think it's something that's not well understood by patients. A lot of my patients ask me, well, I don't understand what is cholesterol, what is LDL, HDL, well, I don't know what this means. So LDL stands for low density lipoprotein, and basically LDL is that bad cholesterol. We can help remember that because L can be for lousy. It's lousy cholesterol. With that, it gets kind of a bad rap. Everybody says it's the bad cholesterol. Nobody wants it. We don't want too much of it, but it is very important. And so I'm going to explain what LDL and HDL do in the context of heart disease. So LDL goes around and it kind of puts little band-aids, that endothelial damage that we mentioned earlier. It's one of the mechanisms that your liver uses to help repair that vessel damage. And so, we think of the bloodstream, we think of blood as being, liquid, and it is, but it really has a lot of things dissolved in it. It's not water, doesn't have nothing in it. It's got red blood cells, proteins, white blood cells, all sorts of other things. And it never stops pumping. And so there's a lot of friction on those vessel walls all the time. LDL puts a Band-Aid on there that helps prevent that friction from affecting the damaged areas so they can heal properly. HDL, the good cholesterol, we can remember that because H is for helpful. it goes out, and once that vessel damage is repaired and the Band-Aid is no longer needed, it helps clean up those Band-Aids so we don't get dirty vessels. So from that, LDL helps to put a Band-Aid out. LDL cleans the Band-Aids up, and so we want to make sure we don't have too much LDL, meaning that we would have a lot of vessel damage. So that's where LDL gets a bad rap, because when it goes up, it indicates more damage, but it isn't bad in and of itself. And HDL, we want to make sure we have enough cleanup crew to go out and clean the Band-Aids. The reason those Band-Aids are bad and why you don't want them to stay out there is over time they calcify and they get really hard and you can't remove them. And so that's one of those major contributors to that atherosclerotic plaquing of the artery that we see. Insulin level. Insulin, even though insulin is used to lower blood sugar, and when we're looking at this, we're not necessarily looking for diabetes, although that is a case where you might have too much or too little insulin, but we're looking in cases where people are not diabetic. If their insulin is very high, it can sometimes indicate that they're having a hard time managing blood sugar, and insulin is an inflammatory thing in and of itself. So high levels of insulin can increase that vessel wall damage. Blood sugar. So I'm going to talk here about the connection between diabetes and cardiovascular illness. So you may have heard of that diabetes is related there. In general, diabetes is an inability to control your blood sugar. Okay, so blood sugar goes too high. When that happens and we have too much sugar in the bloodstream, the sugar actually coats the inside of the vessel wall, and the more sugar we have, the thicker that coating gets. So that isn't a problem for some of the bigger vessels, but when your body is delivering blood to the tissue, it actually delivers it via these very, very small vessels called capillaries, and they are literally one cell wide. They're just wide enough for one red blood cell to go through there. As this blood sugar coating builds up, it can obstruct the vessel enough that now the blood cells can't get through there. And that causes a lot of issues for that tissue. And that's where you may have heard of people with later stage diabetes losing a toe or a foot. It's really terrible. And so the other side of that is that when you can't get blood through the vessels, your body elevates blood pressure in an attempt to try to do that. And both of those things, the blood pressure and the inability to get blood moving effectively, puts a lot of strain on the heart. So that's kind of the connection there between cardiovascular health and diabetes. High sensitivity C-reactive protein is a marker of general inflammation, but it does relate a little bit more to cardiovascular inflammation. Homocysteine is a marker that's actually, it's something we make just from being alive, and it's we get rid of it with a couple of nutrients, but when that elevates, that indicates an increased cardiovascular risk. Iron. So this is the reason that iron, every iron-containing supplement has a child-safe lock on top of it, and also the reason that red meat is associated with increased cardiovascular disease and diabetes is that iron, high levels of iron in the blood, actually produce a large number of free radicals. I'm sure many of you have heard of these, and free radicals are basically free-floating electrons that float around the blood and do damage to everything they touch. All right, so when we get a lot of iron, we get a lot of free radicals, and so we need iron, we need it to live, it's very important, but too much iron is a big problem. And then finally, omega-3s, those are those anti-inflammatory fatty acids. I'm sure that everybody here has heard of those at some point in their life. But so the reason I'm talking about these things, these are just some of the things that we evaluate when assessing somebody's cardiovascular risk. But those are just some of the routine things. Here are some additional things. This was a really neat study. This was from an American Heart Association journal published in 2015. Don't try to read it. That's not why it's here. I just wanted to show it to you. There were 893 participants, and they found some neat things. They were assessing what does the gut microbiome, meaning the bacteria living in the large intestine, contribute to blood lipid levels, those cholesterol and triglyceride levels. They found that the absence of 6 species of bacteria predicted a higher BMI. The gut bacteria also altered HDL, triglycerides, and BMI, and that was even when the individual's age, sex, and genetics were taken into account. So what did they determine? You don't need to read this whole thing, but the last sentence there says, our findings support the potential of therapies altering the gut microbiome to control body mass, triglycerides, and high-density lipoproteins, HDL. So again, all that means is we take a look at the whole picture. We're very evidence-based, so we pay attention to the new things that come out like this. And that's a connection we see sometimes where someone might have issues with their GI system, disordered bacteria there, and that could be a contributor to the triglyceride or cholesterol issues that they experience. A quick note about statins. So again, a lot of people here may have heard of statins. Many of you may be on statins. They're also known as HMG-CoA reductase inhibitors, but statins are designed to lower cholesterol, and they are one of the most common medications prescribed in the United States. So they estimate 1 in 5 Americans has been prescribed one. The only problem with them is they found that a Mediterranean diet is more effective at reducing the risk of cardiovascular disease, even when the patient's cholesterol doesn't come down from the dietary change. And often it does. The other side of that coin that we like to talk about is, nobody gets on a statin and goes and, says, oh man, I'm so happy I'm on a statin. I feel great. That's not something that happens. Statins sometimes have some nasty side effects, including muscle pain and some other stuff. We'll talk a little bit about that. But with the dietary changes, when we fix somebody's diet and get them eating right, people often report not only are they in better health for it, but they feel better. So there's a huge quality of life issue there too. And that's a huge thing that we go after. In a series of clinical trials, statins only increased lifespan by, on average, 5 to 27 days versus healthy habits. And then there is one group of people that should absolutely be on statins, just as the first approach, and that's people who have something called familial hypercholesterolemia. That's a long way to say they have a genetic defect that causes them to produce elevated levels of cholesterol, but not in response to a problem. They just produce it all the time. So those are some individuals that should be on a statin where that's the appropriate first approach. Some side effects of statins: they do reduce CoQ10, which is a very important heart nutrient. They also reduce vitamin K2, which is important for keeping the cholesterol, not cholesterol, but the calcium in the blood at an appropriate level, and that can help prevent some of those atherosclerotic calcifications. And they reduce ketone production as well. Some of the risks: cancer, diabetes, cataracts, neurodegenerative and liver disorders, musculoskeletal and nerve disorders, and heart failure. So they're not a harmless medication. And for some people, they do need to be on them. So we're not trying to vilify them, but at the same time, they aren't always the right first approach. Another thing, you don't need to read this study either. I know it's small. Another thing that isn't always the right approach: you may have heard that if you're over 50, you should be on aspirin. Well, maybe, and we'll talk about why that might be, but that's not always the right approach. This was an interesting study. This was a massive study published in 2018, and it was the effect of aspirin on all-cause mortality in the healthy elderly. So here's what they wanted to do. They wanted to see, does aspirin reduce heart disease in people that do not have heart disease? So they took people that were over 65 years of age, and it was 19,114 participants, so a very big study done over 14 years of time. They followed them, and they said, does being on aspirin reduce the risk of heart disease if you don't already have it? They actually found aspirin increased the risk of cancer, of death by cancer, and it did not reduce the risk of heart disease at all. Excuse me. Dry throat. So for people who have heart disease, aspirin can be helpful, but for people who do not, it is not something you should be taking. And you don't need to hear that from me. The FDA and the American Heart Association had this to say about it. The FDA said, after carefully examining scientific data from major studies, the FDA has concluded that the data do not support the use of aspirin as a preventative medication by people who have not had a heart attack, stroke, or cardiovascular problems, a use that is called primary prevention. The American Heart Association said, because of the risk of bleeding, aspirin therapy is not recommended if you have never had a heart attack or stroke, except for certain carefully selected patients. If you're over 70, taking aspirin to prevent a first heart attack or stroke could do more harm than good. So we have good evidence that aspirin will help prevent the second heart attack, but we do not have good evidence that it will help prevent the first. And so this is something where If you've just started taking aspirin on your own, there used to be this big push. I remember seeing all the commercials. I think they're still out there. Oh, if you're over 50, you may want to take aspirin preventatively. Well, no, probably not. Aspirin is not a harmless medication. However, that's a conversation you need to have with your doctor. If your doctor has prescribed it to you, they have weighed the risks and benefits of aspirin therapy, and they've decided that the benefits outweigh the risks. If you just started taking it on your own, you may want to stop until you've discussed it with your doctor. Okay. So again, it's not a useless medication. It has a great use and it can help prevent certain cardiovascular disease, but it's also not harmless, and it isn't something you should take unless you've been prescribed it. All right, so we've talked about a lot of the things not to do. We've talked about a lot of the problems that happen. So what do you do? Well, here's what we do. So here are some healthy habits you can use to avoid heart disease. Most of the time when people are going to their doctors, they're working on the symptoms rather than dealing with the risks and causes. And I emphasize preemptively reducing the risks and causes. So start now before you have any issues. Prescriptions are useful sometimes, but we want to get it to the point where you never need a prescription. Instead, we must take responsibility for our own health by mitigating the risks prior to the symptoms. So that means enjoying a low carb and low processed food diet, increasing nutrient absorption, optimizing vitamin D and magnesium, normalizing omega-3s and omega-6s, implementing a healthy sleep routine, exercising regularly, and reducing stress. We're going to talk a little bit more about these. So when we give dietary changes in our office, we actually use lab work, we use the patient's physical exam, we use various different things, including what people like to eat, to try to customize our approach. But these are some statements I can give you that are general, that do apply to pretty much everybody. So we want to work on nutrient deficiencies, making sure we're eating foods very rich in vitamin C, vitamin D, K2, and magnesium. Those are all very important for cardiac health. Ensuring we're getting a lot of organic vegetables. I said a low carb diet, so I'm concerned I say that and people are going to think, oh, keto. No, not keto. Keto for most people don't do it right, and it's not appropriate for everybody. But I don't want you to go home and eat cheese fried steak and hot dogs and say, oh, I'm eating a heart healthy diet. That's what Dr. Gelband told me to do. He said, go eat keto. No, low carbohydrate is in low processed foods, low sugars, those kinds of things. And again, we go more into that. Getting healthy fats, virgin coconut oil, extra virgin olive oil, even nuts and seeds like almonds, chia, hemp, and flax. One exception, peanuts are not healthy. But avocado, ghee, grass-fed butter, making sure to drink half your body weight in ounces per day. Avoid skipping meals. Intermittent fasting is very popular, but it's not right for everybody. And again, that's something where we want to make sure your blood sugar is very well balanced, and skipping meals can cause problems with that. And then, of course, avoiding processed foods. Optimizing vitamin D and magnesium. I'm not going to go into too much detail here. Both of these are incredibly important. You're welcome to read these. Vitamin D, we've learned over the last several years, is how many different systems it's involved in and how important it is for all health, not just cardiac health. But we like to say you should try to maintain levels between 60 and 80 in your blood. And the best way to do it is by getting regular, sensible sun exposure. That may not be an option here in Chicago, particularly not in the winter. And so often we'll recommend having a vitamin D3 supplement. Magnesium, very important for a lot of things, including electrical activity of the heart and maintaining a healthy blood pressure. Some great sources of magnesiums: almonds, cashews, avocados, black beans, edamame, and more. Okay, those are some of the great sources. Omega-3s. So again, you may have heard of omega-3s. They're the anti-inflammatory fatty acids. The inflammatory ones are called omega-6s. These do a massive amount of incredibly great things for us. And the best sources of these are marine animals. That's going to be fatty fish, so salmon, sardines, anchovies, sometimes fish oil pills if somebody doesn't want to eat those foods, or krill oil pills. But there are also plant-based sources. However, the plant-based sources, while very healthy, are not as healthy as the marine sources. So I do encourage people to try to get marine sources. And there are vegetarian versions of those like algae oil, but chia seeds, walnuts, leafy greens, all very, very healthy as well. Implement a healthy sleep routine, incredibly important for cardiac health. Here are just some tips. Even if you don't have trouble sleeping, this might mean that you get better sleep. Turn off your electronics and bright light at least 30 minutes before bed. Keep your bedroom dark and cool. Turn off Wi-Fi and put work away. Develop a bedtime routine. So with this one, try to do the same thing at approximately the same time every evening, and you might find that it really primes your body for sleep and gets you more ready to go to bed, and you have an easier time falling asleep. Avoid fluids and urinate prior to going to bed. Avoid caffeine late in the day. We like to tell people if sleep is an issue, try to not have caffeine after noon. Anytime after noon can cause issues sleeping, even many, many hours later. And utilize breathing exercises. So this is a great thing. Sometimes if you're having a difficult time sleeping, just take a few deep breaths while you're laying in bed, and you might find that very relaxing. Exercise regularly. So regular exercise reduces the risk of metabolic syndrome, which is something that often leads to increased inflammation and can lead to diabetes. It releases nitric oxide, which is a really great vasodilator that helps with blood pressure and proper cardiac function, and it lowers inflammation. Some great tips here. Try to get 10,000 steps daily. Park a little further away from where you're going. Take the stairs. Doing strength training is great. That doesn't mean going to the gym and pumping iron. That can be doing little things in your house, including body weight exercises, and stretching and yoga are wonderful. Yoga, also one of my favorite parts of yoga is the shavasana at the end. If anyone doesn't know what that is, that's the guided visualization. It's incredibly relaxing. Speaking of that, reduce stress. Stress is a normal response to an abnormal situation. So when we talk about stress, we're talking about distress, but anytime stress gets elevated, you release cortisol, that stress hormone, and that can increase inflammation, and it can mess with blood sugar too. That's not a bad thing when that happens. That's a normal response. But when it goes up, when your stress stays high and your cortisol never has a chance to go back down, or where we would say when stress is constant and not intermittent, your body never gets a chance to recover. So having increased stress isn't a bad thing, except for when it never goes away. Some great opportunities to improve stress are deep breathing. I talked about that. Meditation or mindfulness. There are a lot of great free apps to do that. I encourage everybody to take a look there. Take a look on the App Store. I'm not going to say their names, but I'm sure you could guess what I'm talking about. Limit or eliminate alcohol and caffeine. Both bigger contributors to stress than a lot of people realize. Caffeine really stimulates the adrenal glands a lot. That's part of how it wakes you up. Exercise and incorporate yoga. I told you, Shavasana, my favorite. One of the best things to reduce stress. Keep a journal. Just being able to get your thoughts out on paper can sometimes help you actually process them. And it has some similar benefits to even seeing a therapist, which I honestly recommend to most of my patients, regardless of whether or not stress is an issue. It's another thing that's incredible. And then finally, acupuncture. Oh, incredible. Really amazing way to relieve stress. We talk to people after they get off the table and they'll tell you they just feel lighter, they just feel better. So that's another great thing. So in summary, cardiovascular disease is prevalent in our culture, and we are often quick to jump to pharmaceuticals to address the symptoms. Rather, through diet and nutrition, healthy sleep, regular exercise, and steps to reduce stress, we can regain control of our own health and potentially stop heart disease before it starts. And that's really what we want, okay? So our goal is always prevention. You know, there's that expression, an ounce of prevention is worth a pound of cure. Well, we take that to heart. No, I'm sorry. The jokes are terrible. I'm sorry. I want to thank everybody for joining us today. If you have any additional questions that we haven't addressed, please enter them in the Q&A section now. Or if you have a specific question or personal question, you can feel free to schedule a free 15-minute consultation by calling 312-216-2452 or visiting us at alignedmodernhealth.com. All right, give me just a second to open up the Q&A section, and let's see if we can answer some questions here. All right. So you've heard mixed messages. Someone asked, I have heard mixed messages about coconut oil. Is it healthy to consume it? Absolutely. Coconut oil is very healthy. So the mixed message about coconut oil is that it's high in saturated fats. And not all saturated fats are exactly the same. Coconut oil is higher in healthy versions of those saturated fats, and it has a few that actually have some really neat special properties, and they're anti-inflammatory. They're even a little bit antiviral. So yeah, those are some kind of cool things. Coconut oil, very healthy. Now, just the same, don't pile on the coconut oil into everything, but when you have oil, that's certainly a healthy option. Excuse me. Give me just a sec. I'm just reading some of your questions. How to help a child with normal weight who has high cholesterol. I can't really answer that specifically just because it's a personal question. It would really depend on the child. That's something where I'd say certainly feel free to schedule a consult with us, and I can go more into something like that. Is intermittent fasting okay? You mentioned not skipping meals. Intermittent fasting, it's hit or miss. It does have some health benefits, but it is not okay for everybody. That is something where I would recommend certainly scheduling a consult. We can talk a little more about that specifically, but the issues that we see in general with intermittent fasting are people that have poor blood sugar control. Intermittent fasting can make it worse. For some people, it can improve their blood sugar, but we would really have to see. That's kind of a hit or miss thing. So that's where we get into really personalizing really personalizing our recommendations to you, because good for some people, not good for everybody. What office are you in? I'm in the Elmhurst and Park Ridge locations. Thank you. How do we know if an acupuncturist knows what he or she is doing? I don't have a good answer to that question. I'm sorry. I would say if you feel like you're getting good results with them, I would continue your care. If you're not, you can certainly speak to them. I recommend speaking to them about it and seeing what they say. But everybody's different. Every doctor is different. Every acupuncturist is different. So I can't, I'm not sure how to determine that exactly. Is resveratrol an effective substitute for statins to lower cardiac risk and LDL? So resveratrol can be helpful. It is anti-inflammatory, but I would not describe it as a substitute for statins. Again, that's a little bit of a personal thing where it's possible that might benefit and even improve the effectiveness of a statin. So the other side here, I talked a little bit about why statins, and I really appreciate you asking that question, actually. I talked about why statins and aspirin might not be good for everyone, or about why they can be bad, but they're not bad for everyone. And I don't want you to think that you shouldn't be on them. It's really about making sure we're taking the most conservative approach we can. Some people need to be on statins, and some people need to be on aspirin. Those are not inherently bad, but it's something where we would want to evaluate that. But taking something like resveratrol for some people can be beneficial in addition to a statin. Mixed messages, eggs. So somebody asked about, speaking of mixed messages, can you address consumption of eggs, which seem to get a bad cholesterol rap? Yes, this has been going, there's a long-standing debate on this that's been going for the past 30 years or so, maybe probably more than that. Where first eggs were good, then they were bad, now they're good again. So right now, the current research tells us that dietary cholesterol, that is cholesterol that you get through eating food, does not substantially contribute to increased cholesterol in the blood for most people. That's not true for everybody, but most people. There is actually a blood test we can do to see, we can look at the type of cholesterol that you have. There's 4 different primary types of cholesterol. They're not LDL, they're like beta-cytosterol and other things like that. And those can tell us where your elevated cholesterol is coming from. Is it coming from food, or is it coming from production in your body? What does the 15-minute consult involve? The 15-minute consult, that's a great question. During that time, we'll sit down and discuss with you. You'll get to sit with one of our docs, and we will talk to you about exactly what we do. We'll give you an opportunity to ask questions about our approach and about any personal situations that may apply to you. And so we can give you a little bit more information about is our care appropriate for what's going on with you, and how can we help you? Is it possible to combine integrative care with traditional? I'm being treated for some heart issues at Northwestern, and am on meds that interfere with supplements like fish oil and curcumin. I want to be able to take supplements. So first thing is absolutely. I have very good relationships with some of the doctors at the healthcare centers nearby where where I practice. Excuse me, that was hard to get out. And so no, absolutely. So I regularly, if we find something, sometimes I may order an EKG or an echocardiogram or other things. If we find something in the blood or something that needs to be managed in more conventionally, in addition to what we're doing, that's something we absolutely do. We co-manage patients on a regular basis. No, we are not care islands. I absolutely love working with cardiologists and primary care physicians and other sorts of specialists on the things that we treat. Yeah, everybody gets better results when we work as a care team rather than just, one person managing care. So absolutely, we do that. Do we accept Medicare? I'm not sure. I believe for some of our practice lines, but I do not believe that it is accepted for our functional medicine group. I would encourage you to reach out to our number 312-216-2452, and they can probably answer more questions regarding insurance coverage. But I will add that the different coverages that you see on the screen in front of you are most of our coverages, most of what we're in network with. All right. Are there any other questions? Oh, and I'm sorry, I didn't answer your other question. Is cod liver oil suitable as fish oil? Absolutely. Cod liver oil, there are a lot of different kinds of fish oil. Cod liver oil tends to be higher in one of the two primary omega-3s. There's DHA and EPA. Cod liver is a little higher in DHA, which has some great benefits. But yeah, it's just a different form. There are cases when we might recommend specifically cod liver oil over another fish oil, but no, otherwise any fish oil is pretty good, and cod liver oil is just fine. Are there any other questions I can answer for you all today? I hope in general you guys have found it informative. Not seeing any, we're probably going to end it here. That's most of the time we have anyway. So I do want to thank everybody for coming out here today. It was really wonderful speaking to you. And again, I encourage you, if you didn't get your question answered here today, or you just want to get more information in general, please feel free to reach out to us at our website or at that phone number 312-216-2452. All right, everybody. I hope you all have a great, heart healthy day.